Hello, everyone. This is Tom Palangi, Chapter President of IFMA Boston. Sorry for the technical difficulties getting things started. Can you all hear me? I have to try to figure out how to unmute people so that we can participate. And I know Jim Connolly is on the line, who will be our moderator today. Okay, I'm about to unmute all attendees for a moment. Hopefully it doesn't get too chaos with people talking over each other. Hi, everyone.
Hello.
All right. Excellent. Jim, are you there?
Hello.
I am here.
All right. Excellent. So sorry for the couple minutes getting us started, but as you all know, you're all very accustomed to probably A, technical difficulties in meetings, and B, adapting as you go. So we wanted to thank you all for joining us. We had a really great, quick turnout for this, developing situation that everyone is facing. So we are going to do our best to manage the mute and unmute throughout the call to make it a good experience. So if you have a question, try to jump in or send us a message through the chat, and we in the questions section, we will be able to monitor that as we go along. So without any further ado, since we do have a short period here over lunch, I will mute myself and pass it to Jim, who is going to be guiding the conversation today.
Thanks, Tom. So welcome everyone to IFMA Boston's virtual roundtable. The topic today is the COVID-19 Business Continuity Information Share. My name's Jim Connolly. I'm the facility manager for Harvard Pilgrim Healthcare. The roundtable topic came up due to member concerns about the coronavirus, and everyone who wanted to hear how other members are dealing with it. So before we start, let's talk about a couple of housekeeping items. We have over 50 people registered for the WebEx, and we encourage everyone to participate in the conversation, but please mute your microphones if you're not speaking, and let's try not to speak over one another. So I can tell you just to kick a couple of things off is from an insurance standpoint, since that's kind of the company I'm coming from, we got some marching orders from the insurance commissioner that you guys may want to know about. So the insurance commissioner sent out a bulletin at the end of last week instructing all insurers in Massachusetts to do several things in relation to the coronavirus. They asked us to set up dedicated lines to respond to calls about coronavirus. They've asked us to relax prior approval requirements and procedures so that members can get timely medically necessary testing and treatment. They've asked us to relax out-of-network requirements, forego any cost sharing, co-payments, deductibles, or co-insurance for testing, counseling, and vaccinations, and also forego any co-payments for medically necessary coronavirus treatments. So that's just kind of an update from what the Department of Insurance is instructing all Massachusetts insurers to do. So just to kick this off, I thought that maybe I would talk a little bit about some steps we're taking, and then we can sort of let's hear from some other folks. So as a healthcare insurance provider, we're lucky enough to have healthcare professionals on staff, and they're helping us guide our decision-making and planning for this kind of emergency. Our goals are to keep staff healthy and continue to support our customers. As you can imagine, as a health insurer, we're going to have an increase in our business load in the next month or so dealing with this, customer services, claims. So, closing down is not an option for us. But we have taken some steps to try to keep our people safe. We've increased cleaning and disinfecting in common areas and in touch points. We've stopped large in-person meetings and instead are using video and audio conferencing. We're encouraging supervisors to support remote work for their staff and reminding staff to bring their laptops home every night. Again, this could be something that at a moment's notice, we could be asking everyone to work from home. We're limiting domestic travel and we've stopped international travel. And we're updating all our department preparedness plans. It was interesting to see that our preparedness plans that we did back for the bird flu probably 7 or 8 years ago still kind of held true to today. So with that, I think we should open it up and hear what other people are doing, hear what questions people have or concerns. And, again, we don't have medical staff on this call. But we do have a whole bunch of facility managers with lots of experience. And let's hear what other folks have to say.
I'd like to, like tomorrow, treat supper.
Hey Dana, it's hard to hear you. You're breaking up. If you have if we can't hear you, could you just type the question?
Oh, sure.
In the meantime, if anyone else had a question or a comment, or somebody, I know there's some other folks on here, the call, whose companies have instituted similar type of scenarios as Jim's company, so feel free to weigh in.
Hi, this is Phil Donahue from Staples. Can you guys hear me okay?
Yep.
So Staples has kind of enacted a lot of the items that was just outlined as far as travel ban. And we're accelerating our contact with some disinfecting vendors, if you will. We have landed in on a company that has nationwide capabilities to possibly respond to any requests that would come out of any of our stores, any of our corporate offices around the country, and then more importantly, any of our FCs and DCs. The name of the company is Interstate Restoration. They're a company out of Texas. You can tell them I sent you. They quickly formulated a plan. They're our disaster recovery company across the company for hurricanes, floods, that type of event. But they are quick to adjust, and they've created a team of individuals across the country who are trained to respond to various locations and disinfect if you have a reported case of COVID-19 in your building. So the gentleman's name is Ron Nardoni. In fact, I could probably give you his phone number if you want. If you don't need it, then you can throw it away. Hold on here real quick. In addition, we've stepped up installation of hand sanitizers here on site. Fortunately, we're in the business, so we had a little bit of leverage on getting some devices in, some backup inventory here for the campus. There's 3,000 people here on site, so it's a pretty big campus. So let me just see here.
Yeah, that's a good advantage you have with hand sanitizers and all that. I mean, there's not much to be found out there. We sort of got lucky, and the company we use for our sales giveaways, the promotional giveaways, had some that they were using for promotional stuff. So we managed to land some of that, and it gets branded and everything.
Yeah.
But you kind of have to be a little bit creative right now to find any of that stuff in the retail area.
So I found this gentleman's phone number, his cell phone number. He might kill me later, but that's all right. Number is 617-901-9426. He's the vice president of national accounts over there. But he can kind of work with your organizations and just to have them, in your back pocket, for lack of a better term, to respond to anything that might pop up, because who knows where this thing's going to go, right? And then the other thing that we've taken on, and we're kind of working this through all of our facilities, is stepped up cleaning schedules, obviously. We even have our front desk security team wiping down the areas where people register and when they come to visit. So
Phil, that's a good jumping off point. We have a question actually from the group, from Gretchen here on the call, and related to that, the question is interested in what other company policies might be in place for visitors to headquarters or corporate offices. So I'd open that up to the group to say what's going on in terms of this scenario and how it pertains to visitors.
So this is Frank. I'm with Marriott International. Obviously, I'm sure some of you are aware of our news presence that's transpiring, and a little bit of items against that, right? From visitations, we've paused our travel, of course, and canceled some of our meetings from a headquarters perspective. We currently work with BMS CAP for a third party. And I did want to provide a little bit of clarification on and guidance. Certainly hard surfaces, as the duration of time is a little bit longer, but you need to ensure the frequency is every shift that you can, multiple times per shift, cleaning those hard surfaces with an approved EPA chemical, right? And an approved Boston certified chemical through the CDC. That is a little bit of the contention around how we're disinfecting our surfaces, that you don't want to use any product. There's certainly approved items out there that you can utilize. We've partnered with Ecolab in that manner. They're a national account for us. They've conducted training with our associates as well. So I would strongly suggest partnering with a vendor that will come and educate the staff members or the associates within the building, one from a cleanliness standpoint, two would be from a knowledge standpoint of COVID-19. We've partnered with the Department of Health and a few of the surrounding hospital networks that spoke with our associates on COVID-19 and the facts. Right, so we're managing through facts and not fear and not media, because as we all know, the media has a job to do, and they're certainly taking full advantage of this. But I would strongly encourage that associates that may have a concern from, one, the visitors, two, speculations around COVID-19, hire somebody to come in. They will normally do that for free to speak to your associates, but it will go a long way in the Q&A, right? So from a Q&A perspective, always have an SME, subject matter expert, that is addressing the population, because trying to handle it from a FM lens or FM perspective might put you in a legal predicament later on. And I certainly wouldn't want anybody on this phone to go down that path. Communication is key, of course, but I believe those are my two main points from one, understand the cleaning concepts behind COVID-19, using the right chemical. You're not needing to disinfect the soft goods, such as fabrics, things of that nature. That is not a part of the COVID-19 scope of work when you're doing disinfectant and cleaning of those surfaces. But it's very similar to norovirus, if you all on the phone are aware of norovirus as well, with the cleaning regimens. So I would just point out those couple of bullet points and items. One, with addressing the associate care piece. Two, noticing and understanding the legal side behind it. And third is what's available out there to the associate knowledge.
Yeah, good points. I think communication is real key. We've got different groups of, different business units in your organization. You want to try to kind of get them all together. We have a crisis management group here that we've kind of formed as a task force so that we're all talking to each other. Supply chain is understanding what retail is going to do, and advising people shouldn't come from local management. It needs to go up back through HR, and HR here has come out with a statement to say, hey, this is what happens if you think you've been impacted by somebody with COVID-19. So excellent point.
And I can just jump in because I know Dana Amaro from Altria Senior Living was trying to speak earlier and audio was a little tough. So he has provided his comment on this, and he's saying that Altria Senior Living communities are also not allowing visits to the communities by any family member or vendor that has traveled out of the country or has a household member that has traveled out of the country within the prior 2 weeks. And this is particularly important because the elderly residents, as we know, are especially susceptible to this strain.
Yeah.
So point on cleaning, Tom, it's Jim Connolly. We had a scare in one of our buildings where an employee was basically in the same health center that later was discovered that a patient in there had tested positive for COVID-19. And he had immediately was put on a 14-day quarantine. However, he did come into the office. So when we asked our cleaning company, again, a union company in Boston, if they could go in and disinfect the cube, the cleaning company refused and basically said that you need to have a hazmat group or someone trained to go in and do that. So it's something that folks may want to just talk with their cleaning companies about is if you do have an infected person, if they will in fact go in and disinfect that workstation.
And that brings up a great point. They need to be certified in that arena. Most cleaning services that most of our organizations might be using, and that's in any facet, they're not certified. Nor do they have the ability to do that type of cleaning perspective, because it is a special case.
Yeah, that's really important too. Everybody's going to come out of the woodwork and say, oh, we can do this.
Absolutely.
Good point.
And I would also, the media side, I think, is a good conversation as well to make sure that your corporate office and the crisis management team is handling the media concerns, as there's certainly going to be some drivers that increase volume of media inquiries. Do not feel you have to respond to those. And I certainly would guide that you don't, but in any perspective, media, they're going to inquire and be pushy, let's say, in this particular circumstance, but I would be very, very hesitant to try to think that you need to react to those concerns from a media perspective.
So Jim, we have another question that I think ties into this. I mean, I guess all these things are related, but the question is recommendations if someone in your office or office park is diagnosed with COVID-19. Do you ask employees in the office to work from home? I know there's been cases of that have been shared in the media recently. So I guess that's the next question to the group.
From our perspective, our policy is that, if someone is even suspected to be in contact with, they should self-quarantine for that 14-day period. And we are encouraging people to work from home if they can, if their job allows it to. So I think, I don't know if that answers the question, but I think that you know, we're trying to keep our people safe. So if we can, anybody that's potentially infected, we need to have out of the workplace. Does that answer the question?
Sure.
I think it does. I mean, if anyone else has other experiences in different companies, they could certainly weigh in.
So this is Frank again. I would honestly, from a HR lens, just engage HR, right? Every company is going to have their own policy on that and circumstance. Yet, I would highly encourage the HR component of that particular item. I don't know if any one of us could truly identify the right answer for that, because every corporate office is going to have a different lens.
Yeah, at Staples, the HR department has come out with a standard statement for all associates across North America, and it's pretty much if you think you've been exposed to someone, work remote for 14 days. You know, that's pretty standard. And then it kind of goes down and it gives next steps for if you have been tested positive for COVID-19. You know, there's that 14-day period that might go into short-term disability or, you know, stuff like that. So that might be something you want to bubble back, or at least check in with your HR departments on what happens if, you know. Yeah,
absolutely. I think that you know, depending on, you know, how do they handle that? Is it sick time? Is it
right.
Are people getting paid? I think that HR is absolutely the place to go and get that information.
Right. And then the other thing that if you do have a building or a facility impacted and you have to close that facility, that same communication process of the who, what, when, where, and why should follow the same track as, you know, what we're doing to prevent and help associates. We're starting to put together some guidelines on, you know, if we get a report of a closing, it's not going to come out from one business unit. You know, they're handling it this way, and then another group might be handling it a different way. All the closings will come from either the crisis management team or HR itself as to what should we do. Where should, you know, should associates not report? We've talked about key.
Hello? Anybody?
I was muted too. I've been talking for 5 minutes here to myself.
Yeah.
No. Bill, no, we've been hearing you. I've been hearing you, but all of a sudden you cut out.
Yeah, no, I was just commenting on possible building closures or facility closures. You know, to the topic of communications, we're planning to use that same mode of communication on, hey, what steps are we taking, what's preventative measures and all of that for those closings, so that we have a uniformed approach for each associate impacted to say, okay, here's what you need to do. And it's not going to be willy-nilly by different business unit across the country, you know. I think that's starting to bubble up now in our case.
And that brings up a great next item. I think from our lens as facility managers and assets, we should have an understanding of when a building is going to close from a corporate level or a national level, how you are to reopen that hotel. What are the SOPs? How do you conduct flushing from a water safety program? If you have a water safety program, what do you do with setbacks of your HVAC and indoor air quality? There's a lot that may not be developed on certain companies that are on the phone. We certainly have our policies and procedures, and we're calling them at tier 1, tier 2, or tier 3. And it all depends on when we put those in place. Yet it is a decision from a case-by-case communication up to the corporate team, which I sit on. Yet I would say our due diligence for facility directors or managers of the asset, we should develop and should have something developed on those particular items and what you do in each case, in writing and a policy and procedure in place.
Very good point. Very good point. This is the time to do it now, before we get into, a situation where we're scrambling.
Yeah, again, the goal is to get your building back reopened as quickly as you can, right? At least here, this is corporate headquarters, so we want to make sure that whatever action we need to take, is decisive, it's done timely, and then we have, we're back open for business, so.
Hello, I wonder if I could ask a question. This is Pat Tolerator with the State of Connecticut Department of Labor. Can you hear me okay?
Sure.
Yes.
Yes, sir.
So I think it was Jim that was talking about the fact that they had an employee that was in a nursing home that had the virus, and the employee had come, and I wonder if he could expound upon the steps that you did take after that. I mean, you talked about needing to get a hazmat company in there. Was it difficult to find and get them, timeline, and then there'd be employees around the area, how you dealt with them? If you could just go into that just a little bit, it would be appreciated.
Yeah, so we did send the employee home and requested that he get tested. He did get tested, and the results were negative.
Okay.
But again, we're going to keep him home for a 14-day period. He was I think in the office for maybe an hour or so before he got contacted by the healthcare provider to let him know that there was someone in the building around the time he was there that tested positive. So, and he immediately talked to his supervisor and went home. Our cleaning company was okay with doing disinfecting around any areas that the employee may have touched, handled, from the time he came into the building until he went into his cube. The place where they would not go is into his workstation. So fortunately, we have a vendor that does hazmat, similar to one of the other. Ron had mentioned, not Ron, one of the other callers had mentioned a hazmat company that would come in and clean it. And they came in with a, basically, it was 5 minutes. They came in with kind of an aerosol kind of gun that put a disinfectant and kind of made a very fine mist of the disinfectant and did the entire workstation, computer, phone, everything in the workstation. So that's how we handled that particular incident.
Okay, thank you. I had one other question just for everyone on the phone, if I could ask it at this point. We've been thinking about here at the Connecticut Department of Labor, in case businesses start shutting down, there would be a flood of individuals seeking possibly unemployment benefits. And even though we have an online service for doing that, our experience has shown that a lot of people that have never been involved in the process before, and just because of human nature, try to come to an office to get some type of service. And even though we might be open, there is some concern on our part at some point we may have to pay attention to having large groups of people, whether they're standing in line or they're in our lobby areas, congregating like that. And I'm wondering if anybody has done any thinking about a situation like that and how they have thought about addressing it. It's kind of probably a particular problem for us, but there might be somebody on the line that has a situation where they might get a lot of public coming to them for particular needs. I mean, such as hospital waiting rooms, I guess. No one, huh?
No.
We really don't have that. It's not a public building. It's private. So,
Right. Yeah.
I mean, that's a really good question, but that's maybe a bigger question for local agencies and health officials to say, what is the plan,
Yeah, I mean, we've obviously thought about, limiting just to telephone and computer only. But we don't have the infrastructure necessarily built to handle that. And
Right.
if they start closing all schools, small businesses start closing, even large businesses.
Yeah, I know, I did read somewhere that, I don't know if it was the CDC or maybe it was a Massachusetts thing where, they're encouraging people not to rush to the hospital because that facility may or may not be able to test for the virus, right? But to kind of call ahead and say, hey, what should I do? Is there a better facility to go to versus not,
Correct. Yeah, that was, I think it was Marty Walsh that did the announcement on don't go to an area where you feel you might be susceptible or maybe with COVID-19. Call, set up an appointment, make sure you're walking in and they're prepared to take you, so that you're not sitting in that area amongst others or congregating. I can tell you just from what we're seeing, a lot of businesses are not hosting meetings, right? So they're canceling travel plans or they're canceling travels. I travel for what I do, and I can tell you the planes are not full of people, airports are not packed. A lot of those public areas are not seeing as many people traveling at this time, and companies have limited their travel. So I would say there's already an adjustment in place from corporate levels that are hindering travel or saying if it's not a necessary or critical need, do not go. Make sure that you're working from home and not congregating. Obviously, all of our buildings for Marriott are all public. So we're still going to have people in there, but it's pending what we're seeing as our clients and our customers.
Yeah, another thing to keep in mind too is technology. I know here at Staples where we have Microsoft Teams software through the Office 365 program. So, HR has come out within the same directive to say, hey, although we in travel, feel free to use some of this technology to, continue to do business with suppliers, with potential vendors and whatnot. So instead of meeting face to face, we're asking associates to think about using technology in its place.
Yeah, we've definitely done the same thing with Teams.
And speaking of technology, you've seen, if you're on a computer or on your device, you've seen we started to launch a couple of polls throughout this talk here. And as you were talking, Frank, about travel, we had a question, and it's still up right now if you'd like to vote. Has your company put a travel ban or limitations on your people? And as of right now, and we can share this information after the fact, but we are at 81% yes. 817 is moving up and down. So we're in upwards of 80% yes in terms of travel restrictions thus far.
Yeah, I'll give you a personal. So obviously I travel. I only had one trip. I had 4 trips planned this month. 3 of them I canceled. I'm on one currently, but I won't travel after that.
I have a question.
Please go ahead.
My name is Todd Isherwood. I am a part, this is a unique facilities question. I'm glad Marriott is on the line. Hopefully they're still on the line. I am a part of a large, actually chairman of a board of about a 2,500 member church here in New England. We own 2 facilities and we've taken emergency response preparation with our facilities and worshiping them, but we do not meet in those facilities. All of our members don't meet there. We actually have meeting facilities with folks like Marriott and other rental facilities. And so the question comes down to us from a facility standpoint is when do we, what signal, who do we listen to for signal to stop worshiping or meeting together? And if we, in general consensus internally has been the government's going to tell us that, whether it's Marty Walsh or Governor Baker, just like what happened in Italy, the government told everybody to stop, if you've read the paper, stop worshiping in churches, But if that happens, we have over, 250 reservations that are in place in contracts. has anybody thought about what the ramifications are for waiving or voiding contracts because of this? The airlines, we've seen the airlines waive sort of change fees, but I'd like to get Marriott's perspective on this. What is their take? I'm sure they're taking a big hit right now, but what is their take on cancellation of meetings and refunds or breaking obligations?
Yeah, sure. So I'll take that question. This is Frank. I represent obviously FM and engineering for the discipline for Marriott, yet you can imagine I'm on a lot of phone calls with these individuals and that particular topic. When it comes to cancellation fees and contract negotiations, we are not waiving those fees, because if you're not coming from an affected area where you're not able to attend based on a government shutdown or a airline shutdown, but we're also asking for an alternative date later in the year to keep the booking and move them to an out time frame in the year. So we're giving way more options than that, but the two boiled down items would be, we are seeking to not do cancellation unless it is an area in which there is a COVID-19, such as Italy or China. We would certainly take that into consideration, and or moving them to a future out date in the year, so that we're providing more options. So really, we're providing a lot of options for them. We're certainly working with all of those groups, because as you can imagine, to your point, there's quite a bit, and we're looking to understand how can we accommodate, right, without just let's just cancel to cancel. We want to have more conversations with them, so it's more detailed than that, but I would certainly say those are the two highlights.
No, I understand that. I'm just, it really depends on the first question, which is what authority shuts down meetings. Is if the government, if Marty Walsh says, okay, nobody's meeting here in Boston right now, they cancel the St. Patrick's Day parade, that I'm sure that has consequences, but from a corporate standpoint, from a legal standpoint, is it the government then what is the next step after that? They say stop meeting. Do we what is internally businesses saying as far as their contract obligations? Is that null and void, or is this considered an act of God in your contract? I know we got to read our contracts, but it'd be interesting to hear what other people are doing, or how they're preparing themselves.
Well, I guess we don't have anyone else on the line with that unique problem. But I would guess that the only way that we're going to shut down businesses like that would be if the governor put in a state of emergency for the state of Massachusetts. Would probably be the only way that we would stop with a government sanction to stop businesses from meeting and traveling.
Have you heard anything from New York, the state of New York, after they declared a state of emergency, and what are the consequences of that regarding facilities?
I have not.
I have not either. I'm actually in New York today. I have not.
Thanks for letting me ask my question.
So just to keep the conversation going, looking at the agenda that we had there, one thing that sort of came to mind to me yesterday as I was reviewing with my staff our plans was the idea of a secession planning. Not to think that we are all immune from whatever comes that we need to pay attention to making sure that we have somebody else that can take our place and so on and so forth, so that in the event any of us do come down with the virus, we have somebody that can cover for us and has access to the systems that we have access to and all that. So just a sort of thought as we were putting the agenda together yesterday.
It's a good point. I never really thought of that. It's not just locally, but across the entire leadership, you know?
Exactly.
I'll bring that up today on our crisis management call. It's a good point.
Another thing that we implemented was we have our mail clerks and receiving people using rubber gloves or latex gloves while sorting the mail and receiving packages. Again, not knowing where all that material is coming from, we want to try to keep our mail folks safe. We left optional whether they want to wear eye protection or face mask, and really all that would do is hopefully keep them from touching their face after they've sorted the mail. But that's just something else that we've put in place this past week.
This is Jeff at EMD Serrano. Can you hear me okay?
Hi, Jeff. Yes.
So I was just curious, how are some of the organizations on the phone handling face-to-face meetings? And also, how are organizations on the phone handling cafeteria usage, like large cafeteria spaces?
So we are trying to limit face-to-face meetings to, well, in two ways. I guess less than 40 people is kind of what we put as a benchmark. So that eliminates a lot of large company meetings. And we've also restricted to fewer than 15 outside attendees outside the organization, and are encouraging folks to do video or teleconferencing for meetings as they can. From a food service standpoint, we had a conversation with our food service provider, and they have a sort of a crisis management team that are giving guidance to the food service provider around prep and when they should think about, getting rid of things like the salad bar and going to pre-made salads, that kind of stuff, and reducing self-service. But we haven't hit that point yet. But they are putting up signage and, reminding people to, not sneeze in the self-service stations or, use not to pass utensils around. So from our perspective, that's what we've heard and have learned so far in our areas.
Yeah, this is Phil from Staples. We have a full service cafe on site here, and back a couple of weeks ago, our Chef Lewis is our food supplier here. They had their own set of protocols, and they implemented some of their cleaning protocols to wiping down stations more than they normally would with disinfectant. And we do have a pretty good buffet set up for salads and whatnot. And we put some plastic gloves, more than, not the kind you get at the medical office, but something that can go on quickly so that they can use gloves to pick up and make salads or whatever is in the buffet. We've also put hand sanitizers at the entrances. So as people walked in, we were encouraging folks to, zoos underneath the hand sanitizer, kind of get some on their hands before they get into the cafeteria. I don't know if that helps.
No, definitely. We instituted some similar things about the salad bar and self-service. I appreciate that. Should have been more specific. So all that's great, but let's say you have a large cafeteria. Now you've got over 100 people sitting shoulder to shoulder, eating, conversing. You know what I mean? Like we talk about meetings, reducing meeting size, but then we have a cafeteria with large amount of people. I was just curious, what's the next step, or what are people doing with that mass of people?
I mean, that would be close to closing your facility, right? I think, you know, we're taking the approach of, right, everybody has to use common sense. You have to protect yourself. Wash your hands. I can tell you how many times I washed my hands since this whole thing started. My mom would be proud of me, right? But it's from our standpoint, it's, you know, let's use some common sense and not panic. I think, you know, panic has people behaving in different ways than they normally would, if you will. So I don't think you can ever prevent anybody from talking or coming in contact with one another. And those that are sick or not feeling well, come to work, you know. It's okay not to come to work, I think. So
Yep. Thank you.
that'd be my view on it.
This is Ashley White from Babson College. Can everyone hear me?
Yes.
Yes.
I was wondering if there are any other colleges on the line and what they're doing. I know there's been some talk on Harvard and UMass and what they're doing. We are prepared to go fully online, which has been communicated to our students and staff. We're currently banning all non-essential college-sponsored travel and urging the community to follow CDC guidelines for travel, which includes prohibiting travel to level 3 countries and requiring self-quarantine for anyone returning from those countries. But this really does affect our students for spring break, just because most of them that would go home, some of them can't. We're a huge international campus, which then affects some of our support that normally shuts down, like our CAF. And we're also fortunate enough that we have some residential properties that are currently vacant that are normally used for staff, renting out to staff or faculty, and currently setting those up as quarantine areas if the need arises to move infected students. So I'm just wondering if there is any other colleges on the line.
Hi, yes, my name's Deirdre, and I'm calling from a college in Boston. Hello?
Yes.
Sorry, it was muted again. And what have you guys taken? I'm not sure when your spring break is, but kind of to prepare for that.
So there's a couple of things, and I know that our expert Patty is on the line. Patty, can you speak to that? Patty? Okay, if not, yes, we have sent a note out about travel. We canceled all of our student trips that were scheduled for spring break. We haven't moved to online classes yet. As we're talking, I see that a breaking news story just came in that Harvard has shifted to all online classes for the rest of the spring. So I don't, one of the things that I'd be interested to hear about colleges is, and other universities, is how are you paying your employees when they are out? The non-salaried employees, if the school closes down.
I think that's an across-the-board question, and it's really sort of an HR. I'm not speaking for colleges, but I'm speaking for our organization. It's really an HR-driven question.
Yes,
Again,
I am in HR.
Depending on whether they're union folks, non-union folks, what the collective bargaining agreements call for. I know that we anyway are paying staff, so I can only speak for us.
Thank you.
So we've got a few minutes left. Do we have any other comments, questions while we're still all on the line?
Just one other comment I would make. a business perspective, it's just making sure we're tracking all of our costs associated with the actions that we're taking. Maybe some federal, state funding that's available after the fact. It's going through a legislative process now at both the federal level and at state levels. So making sure you're keeping track of it is not a bad thing to do.
Good point.
Good point, yeah. Well, this is Phil. I have a hard stop at 1, so I need to get ready for that. But I'd just like to thank Tom and setting this up. This is great. We should do more of these. I think having it online and on the phone makes it really convenient for us to maybe connect. You know, it's not always easy to get together face to face, and given the situation, it probably doesn't make sense, right? So thanks again. Appreciate everybody's comments.
I'd like to say just I think I'm the only one probably from out of state, but Connecticut IFMA thanks you for involving us in the conversation.
You're welcome.
Yeah, this is Bruce McIntyre at a public school in Vermont. So you're not the only out-of-state guy, but I really appreciate listening to this conversation. You know, we're much more rural here, but still dealing with a lot of similar problems.
So that's a good case for us to do more of these virtual roundtables versus the in-persons.
Yes.
Absolutely agree. I think we're going to be leveraging technology more than ever and finding what works from a communication standpoint.
Mm-hmm.
I just want to say thank you to IFMA Boston as well. This is Frank again. And I appreciate Tom and everyone's engagement on the phone and candor around this sensitive topic. And we appreciate it.
Well, excellent. Thank you all very much. And we will follow up with any more information we get about this topic. And thank you for participating.
Okay. Thank you, Tom.
Thanks, Jim. Bye-bye now.
Okay, bye.
Thank you.
Thank you.